Okay, good afternoon, everyone from Singapore. Welcome to this session on the healthcare leadership. Welcome to this session on the commercial determinants of health. As people are still streaming in, I will just delay a little moment and start by introducing to you our three panelists. First off, we will have Dr. Lacy Nichols, who is a postdoctoral researcher at the University of Melbourne. She's the perfect person to speak on this topic because her research examines the political and market strategies of powerful corporations. She's interested in power and basically who has it, how do they get it, how do they use it? And especially when they use it for, not for good, but for bad, then the question is, what cracks are there that to help the rest of the world, keep them in control and to change the world if necessary. So her PhD has explored how the food industry in particular has been repositioning itself as part of the solution and not part of the cause of the problem. This actually has got similarities throughout a large part of other commercial enterprises. So I think we look forward to getting a good grounding on these commercial determinants of health from her. She's going to be speaking first, and based on her delivery, we will have respondents who are Dr. Renzo Guito, who is Associate Professor of the Practice School of Global Public Health and the inaugural Director of the Planetary and Global Health Program at St. Luke's Medical Center, College of Medicine in the Philippines. He got his Doctor of Public Health from Harvard, but I won't go through his many involvements because they are very long list indeed. So he will be the first respondent, and I think he will expand what Jen will be speaking about from the focus, the frameworks of the commercial determinants of health to the concept of planetary health and how there are more far-reaching consequences beyond just the health of the population. Then after that, we have Mr. Yi Ping Yi, who is the Deputy Secretary in the Ministry of Finance in Singapore. He is responsible for planning, financing, and programs in MOF, and he's got a very broad range of experience, working in the Central Provident Fund, which is the enforced health and retirement savings system in Singapore. But previously, he was with the Public Service Commission in the government, with the Ministry of Health, where we work together, and the Ministry of Trade and Industry as well. So these three perspectives would be a good, hopefully we can converge and have a good integration of the different concepts. While we are seeking to improve the health of the public health population, much of what we need to work against actually is part of a much broader fabric in society, because we can try to stop certain industries from polluting the ground, hurting the people and so on, but they are also providing jobs. So the question is, where do we find the balance? So let me just, we've got about 232 people who have signed on, and I see that the numbers are about leveling off. So I shall turn the screen over to Jen, who will lead off in our discussion. So please go ahead, Jen. Thank you.
Thanks very much. Give me 2 seconds and I shall share my screen. All right, hopefully everyone can see a bunch of students at Emory University doing their annual Coca-Cola toast. Interrupt me if you can't see this. So I tried to pick some interesting, provocative image to start off all of my presentations on this. And this is Emory University. They're renowned for public health research. The campus is right across the street from the Center for Disease Control in the United States. And for those who don't know, the land of the university was donated by the founder of the Coca-Cola company many, many years ago. And as a gesture of appreciation to Coca-Cola, every year the incoming freshman class has a toast to the Coca-Cola company to say thank you. And this illustrates one of a myriad of ways that very powerful corporations are embedded in our lives, and especially embedded in public health. I said I'd start out with something provocative, and as I came on, us in the panel were talking about these harmful industries, and someone said, "Oh, I can't think of a good reason to work for one of these companies. It'd be really hard." And I said, "Oh, actually, I have one right now, because I'm on parental leave right now, and my company gave me some good parental leave, and My partner didn't get very good parental leave, but you know who gives really good parental leave? Rio Tinto, BHP, Sportsbet, gambling, you know, harmful industries. And that's one of the terrible things, and I'll come back to that a little bit, is that while we like to think that we could say the commercial actors are these clear, defined, very problematic things, in actuality, there are health promoting and health harming dimensions to all commercial actors, and trying to tease that apart and try to tease that apart in a way that's not gamed and used by corporate social responsibility, or, you know, isn't too nuanced or too complicated, is very, very challenging and something I'm working on. So I'll be talking about two things. What are the commercial determinants of health? And then a little bit around what can we do about them, or perhaps what should we do about them? This great big stack of papers, for the record, is the Monsanto papers. I researched food, and so these are the discovery documents, just like we had with Philip Morris. Lots of interesting things around what commercial actors are talking about. So I'm talking about the commercial determinants of health. This is an academic term. A whole range of different terms have been introduced around this. This sort of illustrates the growth of research in this space, starting out with some of Nick Freudenberg's work at the beginning, talking about corporate disease promotion. And then you can see that red line, that's the commercial determinants of health. And all of this literature is really talking about the same thing. And it's sort of illustrating a huge interest in the past 2 decades that's really taken off, researching how commercial actors are impacting on health, about 2 decades after we started talking about social determinants. So what are the commercial determinants of health? The most common definition is probably from Ilona Kikbush and colleagues, and that says the strategies and approaches used by the private sector to promote products and choices that are detrimental to health. The key thing about this definition is that they're talking about health impacts that are harmful. So really what they mean is the commercial determinants of ill health. Another definition, and this is an evolving sort of area, is Nick Freudenberg's from last year, and he says the structures, rules, norms, and practices by which business activities designed to generate wealth and profits influence patterns of health and disease across population. And a key difference between these is that Nick Freudenberg's definition is much more neutral in its framing. Similar to the social determinants of health, these factors can be health promoting or health harming, depending on the context, depending on the actor. And so these pictures down at the bottom illustrate some of the diversity of ways that businesses can impact on health. So the most obvious one probably is thinking about their products or their marketing practices. We could think about the pharmaceutical industry and it's linked to the opioid epidemic. We can think about the tobacco industry and it's linked to lung disease. We can think also about sort of production practices. So that lake there has been contaminated by the production by Dow DuPont of its chemicals. And so that's some of those production practices. We could also think about employment practices. So this could be things such as occupational hazards. For anyone following last year, the meat industry with COVID-19, we can see that there are some very dangerous practices there, or Amazon's treatment of its workers, the gig economy. We can think about how businesses impact in the political world. So through lobbying, through campaign contributions, through the revolving door, and the extent to which then they try to influence policies, either blocking health policies that might harm their business but benefit public health, or trying to shape, the business environment in that way. We can think about the impact on science and on knowledge, either through conducting research or how they're framing issues. And more broadly, we can think about that economic system in which we act and in which businesses act that benefits businesses and which they actively try to foster. So capitalism, neoliberalism, the ongoing privatization of public works. These are a range of ways that commercial actors impact on health. And again, I'm focusing very much on the negative right now, but there are definitely positive impacts, and I'll come back to that. This is a very busy slide. The only thing I want you to pay attention to is what I've highlighted in blue. And what I'm trying to show here is that while the commercial determinants of health are very broad and capture a range of different things, often we focus simply on those commodities, the products and practices are very obvious: alcohol, tobacco, ultra-processed foods, gambling, arms. These are the sort of easy, obvious ones, but we are thinking much more broadly around this. And there are certainly some limitations to focusing just on products that I'll come back to. sorry, this is my commercial determinants iceberg, and the obvious stuff is what's sticking out of the water. This is what people probably think about when they think of commercial determinants of health, and certainly there's an enormous body of literature and evidence talking about this. But there's a lot more to the commercial determinants of health that sort of sits below the surface. This is my very cheesy analogy, sorry. We can think about the gig economy. We can think about philanthropies, not-for-profits impacting on that. We can think about big data, consulting firms, tax avoidance is a very big one in that sense that we're depleting public coffers. And to take my cheesy analogy just a little bit further, we can also think about the extent to which this iceberg exists because of an enabling context, and that's that capitalism, that's neoliberalism, that's privatization, deregulation. And so that's the sort of water that keeps this powerful commercial iceberg afloat. Done with my cheesy analogy, sorry. So talking to medical students about this, talking to people in public health, this is a slide that we put together to teach a bunch of first-year med students about the social determinants of health, and I use it to talk about how commercial determinants impact on so very many facets of this. We can think about economic structures. So this is when Vietnam joined the World Trade Organization, they had to lift restrictions, and all of a sudden we have foreign direct investment from the beverage sector, and lo and behold, consumption of sugary drinks increases dramatically. We can think about influencing on the political sector. This is when Coca-Cola paid protesters to pretend that they were lobbying in part of a grassroots protest. We can think about their influence through the media. We can think about their influence in food security. This is Nestle employing women in Brazil to deliver their products to very remote and regional communities to sort of spread their footprint. And we can think about, water and sanitation as well as a key social determinant, which many companies work on. A lot of my examples come from the food sector because that's my area of expertise. The other thing that's really hard with the commercial determinants of health is thinking about, well, who actually are we talking about? In the literature, and this is something I'm working on right now, we often use the term private sector or commercial actors or corporations very generally, and we don't ever provide a very specific definition of this. But if you start poking and prodding at what it actually means to be the private sector or to be a commercial entity, there's an enormous amount of diversity there. The most obvious one is just that, we have very tiny businesses and we have enormous businesses, and they are not going to have the same impact on health. You have companies that have enormous market concentration, that have a huge geographical spread. We're talking about transnational corporations. We have teeny tiny mom and pop. Those are both the private sector, but we don't really want to lump those two together. We can think about the different goods and services that companies provide. Manufacturers of apples and bananas and fresh fruits are part of the same commercial world that Philip Morris, producer of tobacco, is. But some of those products are very much health promoting. We can think about public versus private, and increasingly the blurring between this as we have state-owned enterprises and some of these public-private partnerships, and then just the range of forms that this can take, including, I would argue, individual elites. Certainly Jeff Bezos, Warren Buffett, some of those major CEOs of corporations have a significant impact, both on wealth distribution as well as the political process. I'm throwing in a lot of things out there. Sorry to make this perhaps complicated. And so I guess for me, the big question is, especially around size, my focus is on powerful transnational corporations. And I would argue that the focus should be much more around the size and political influence of a corporation rather than on the products that they provide. Provocatively, I would say that if you're a tiny artisan alcohol or tobacco manufacturer, you probably aren't nearly as worrisome as a very large multinational company, even if you do something that's ostensibly a bit more health oriented, perhaps health insurance. And so I'm always more concerned about power and the influence on politics than the market. So that is my very brief introduction to what are the commercial determinants of health. And just very quickly, I'll talk a little bit about sort of what we can do and what are some of the debates around how we might do this. So the first question we need to ask is, what do we want to change? a lot of our focus tends to be on the left. We tend to focus on the unhealthy products, whether it's tobacco, whether it's alcohol, whether it's soft drinks, ultra-processed food, gambling, etc. Some of these examples are probably a little bit more food specific, but that's that. We could also think about the political strategies. We know that businesses often have an inordinate influence on the political process. So are we actually trying to change how they engage with politics, restrict that, change some of that, provide more transparency around that? Are we trying to change those means of production? Are we talking about marketing? Are we talking about their supply chains or foreign direct investment or market concentration, some of these sort of broader systemic issues? Or are we actually trying to deal with this last column, which is by far the most far-reaching, but the most difficult to deal with? You know, are we talking about globalization and financialization and neoliberal policy environments and tax havens? These are going to have the most far-reaching impacts, but they're going to be incredibly challenging to address. But I think before we start thinking about how we address the commercial determinants, we need to be very clear about what we actually see as the problem and what we want to focus on changing. So if we're trying to think about changing this is my beautiful slide of upstream and downstream policies. We tend to do a lot of the right, you know, our downstream, I'm sure you all know the analogy. People are trying to cross this river, they're falling in the river and they're drowning. So the downstream solution is you fish them out, you rescue them one by one individually. And these are all of our individual things: education, you know, labeling, information, stuff that targets individuals. Very easy to get across the line, lots of government support, lots of business support, but it targets the individual and often tends to exacerbate inequities. Upstream, you know, you build the bridge, you change the environment so the risk is no longer there. These tend to have a much more equitable impact across populations, but much harder to get across the line politically. And I'll say these here are really, to an extent, sometimes product focused, but you know, we could add other things such as a living minimum wage to some of these lists as well. I would add, so the slide on the left, I'm speaking from Australia here. This is about sort of the decline in smoking in Australia and all of the different policies that were implemented. And the point of the slide is to simply say, there wasn't some single policy that was this magic bullet that all of a sudden had this dramatic public health impact. There was an enormous, you know, for 20, 30 plus years, we have had a range of policies and all of them together have this. I research food, obesity. We can say, you know, no single action will solve obesity, but we tend to see the ones that are starred, those tend to be your downstream easy ones. We need all of them to be effective. And I think thinking about the commercial determinants is interesting because in some ways it allows us to target a range of different risk factors together. When I was preparing for this, I went through and I researched some of the risk factors in Singapore to look at that local context, and I stumbled upon the Global Burden of Disease study published in The Lancet. And we have all of these risk factors. And I got very annoyed looking at the ones that are in purple because these are called behavioral risks. And I have tobacco and dietary risks and alcohol and malnutrition. And me being the commercial determinants of health researcher looks at those and said, those aren't behavioral individual risks. Those are very much linked to businesses and corporations and corporate practices and marketing and all of that. So I think in targeting the commercial world and focusing on that, we can address many of these risk factors all together rather than treating them on a product by product basis. I've got 3 more slides, I think. So thinking about what we could do to address commercial determinants of health. If we're thinking about governments, we can talk about some of the more downstream regulatory options. These are, again, probably focused a little bit more on information and on products. Or we could talk about some of the more upstream ones, restricting campaign contributions, tax reform, minimum wage, having disclosure of lobbying and political donations. I'm doing a research project on this right now, and government disclosure in Australia is shocking. Whistleblower protections, public funding of science, so we're not relying on businesses to provide that funding, and reflect that all of these upstream ones are really targeting much more corporate actions as opposed to some of their products. We could also take the pathway of having industry involved in the solution. And we see this quite a lot. And this is what my research area has always focused on, in looking at pledges, commitments, public-private partnerships, benchmarking. A lot of my research looked at soft drink reformulation to remove the sugar from soft drinks to make them a little incrementally healthier. And I would argue that I'm wildly cynical about many of these public-private partnerships. They tend to improve the public image, their relationship building activities, they're fostering legitimacy. We have a range of different ones here. They're all partnered with very credible organizations, including the World Health Organization. But having industry at the table, there are significant conflicts of interest around some of this. And just very quickly to talk about that limitation of a focus on products, a lot of my research has been on the soft drink industry, and we certainly see that Coca-Cola and other powerful companies have seen the market, have seen the pressure, and they're changing their products, they're reducing the sugar. We've seen a range of commitments as companies threaten to roll out taxes. We've seen this across many of the Asian countries here. And companies are diversifying and reformulating their portfolios. And you read the annual reports, and this is a very profitable initiative. In the UK, profits are up, sales are up around some of these products. So the question then is, well, we've made these products healthier, but the corporation is just getting bigger and more powerful. We see the same thing with vaping and e-cigarettes. We see the same thing with low alcohol beers as well. So are we trying to target products, or are we trying to target the corporations? Here again is just an example of the tobacco industry's investment in all of the e-cigarettes and the non-nicotine products. We're not weakening the corporations. We're simply changing what they sell. So my very last slide, these are sort of questions. What do we want to change? Are we changing our goods and services? Are we changing marketing and political activities? Are we trying to actually change the distribution of wealth and power? And then how do we do this? Is this via governments? Is this via businesses, social movements? And what resources would these different stakeholders need to achieve change? What is our sort of end game? Yes, that is me. I think I'm hopefully within time.
Thank you very much, Jen. A great deal of thought here. And I feel like I need to pause and let me shake down, but unfortunately, we need to relentlessly move on to our next speaker, who's going to be Renzo. He will be presenting his own slides, but also to both follow on and expand on what Jen has said, but also to expand the whole discussion space around how we hope to move on in terms of both public health as well as sustaining the economies. Okay, so over to you, Renzo.
Thank you very much, Jason, and to the Soswi Hawk School for this wonderful opportunity. And it's really a pleasure, in a way, responding, but also expanding on Jen's elegant lecture about the commercial determinants. And so I would like to bring in some additional perspective coming from the planetary health lens. If you find the commercial determinants of health quite a novel concept, although Jen also mentioned that it's not very, recently, invented, you might be wondering, what are the commercial determinants of planetary health? And let me discuss about that in the next couple of minutes. So I know I'm speaking at a public health school, but unfortunately, we now live in the day and age of planetary health. And from a planetary health perspective, our patients are not just any more people, but also the planet. And the reason is because right now, we are seeing unprecedented global transformations in the environment, in our natural ecosystems. As you can see here, anthropogenic change, human-induced change, our consumption patterns, which Jen has mentioned several times already, demographic shifts, urbanization, migration, but also technological advancement, which is also hugely driven by the commercial forces, all contribute to the further destruction of natural ecosystems, the worsening of climate change, creation of new forms of global pollution, which then in turn affect human health in many different ways, as you can see on the right, from malnutrition, infectious diseases, chronic non-communicable diseases, even mental health, all driven by these changes in the ecosystem. And if we want to protect the health of people, we want to make sure we also protect the health of the planet. And this is the situation now. There is a concept developed by the Stockholm Resilience Center. It's called the Planetary Boundaries Framework. And if we have health indicators for humanity, we also have indicators for the health of the planet. And as you can see, 2 out of 9 planetary boundaries have already been violated. That is biosphere integrity, because over the past century, we've seen the fastest rate of extinction of creatures great and small. But also we are seeing the disruption of biogeochemical flows of nitrogen and phosphorus, which, by the way, has been produced because of our addiction. And this is another form of addiction to artificial fertilizers in large-scale agriculture. So 2 out of 9 have already been breached, and more are yet to come, unfortunately, as you can see. And so how do we make sure that the commercial determinants do not only or how do we make sure that the health of people are protected from the commercial determinants, but also the planetary boundaries are not violated as well? And so when we look at the commercial determinants or the role of the industry in environmental destruction or pollution, there's a long history as well. If you can even go back to Rachel Carson when she first, talk about, environmental pollution, and then all these, books about, Merchants of Doubt by Naomi Oreskes from Harvard, looking at how both tobacco industry, but also the fossil fuel industry have actually used science to really, as mentioned there, obscure the truth. We've seen climate negotiations being flooded by coal companies. And of course, who will not forget the disasters, the Exxon Valdez oil spill that happened in the early 1990s, and also the destruction of the Amazon forest, among other rainforests, including the ones in Southeast Asia, because of mining, but also because of illegal logging. And so it's important to remember that commercial determinants can harm the health, not only of people, but of the planet as well. And as commercial determinants harm the health of the planet, they also harm again the health of people. So actually, we are being harmed by the commercial determinants, not just once, but twice, directly and indirectly. And this is a framework from John Quelch from the Harvard Business School. He came up with this classification. Where is your business in terms of its distance from health? Is your corporation or company compatible with health, or is it somewhere in between, in the gray zone, or is it totally incompatible? Maybe because, for instance, tobacco has already been deemed by the global health community as totally incompatible to health. We don't get any benefits from using tobacco. I think this same logic can be applied to corporations in terms of their distance from health, in terms of planetary health. Are they companies that contribute to the preservation, for instance, of nature and the prevention of new forms of pollution? Or are they the ones who are really at the heart of the climate emergency and planetary crisis that we are seeing? And so let me give some examples of how maybe the commercial determinants of public health and the commercial determinants of planetary health actually seem to interact and even converge. And, Jen mentioned that one of her research areas of focus is the soda companies, right? The soft drink industry. And we have to remember that the soda companies do not only help drive obesity and diabetes and other forms of non-communicable diseases, but also they've contributed to the depletion of resources, especially water resources. And I invite you to read this commentary from the Lancet Planetary Health about, it's an expose about specifically Coca-Cola being concerned more about water issues rather than, their role in obesity. And they're concerned because their businesses heavily rely on access to water. But as they use more water and also as they produce more plastic, for the plastic bottles, they actually imperil the ability of surrounding communities to access clean water. So they're actually competing with people when it comes to clean water access. So another example, and I remember Jen said, we should go beyond the product and maybe go beyond the unhealthy products. Let's go to the pharmaceutical companies, pharmaceutical industry. Products that we know are beneficial to health. But we know that one, it is still a battleground in global health in terms of high prices and, inequitable access. As we now see in that map, vaccine inequality is what we're seeing now in the day and age of COVID. But we also should not forget that the pharmaceutical industry is also contributing to carbon emissions, to the destruction of ecosystems. And there's an interesting study, as you can see there, big pharma emits more greenhouse gases than the automotive industry. And so how can we have healthcare industries that save lives on one hand, albeit in an expensive and maybe in an inaccessible manner, but on the other hand, destroy the planet where where our health and sustainability depend. So, it's a very interesting, dilemma that pharmaceutical companies will need to address as well. Another example is when it comes to health infrastructure. Again, we always think, oh, medicines are good for health. New hospitals and health facilities are good for health. But my question, and maybe some in the audience who are from the healthcare industry, I wonder if your hospitals and health facilities have been built in places where there was a need to destroy natural ecosystems. I think in the future of planetary health, no hospital and healthcare facility should be built by decimating trees and displacing endemic species. And this is a real issue now, for instance, in the Philippines. As you can see here, there's actually a proposal to build a mega vaccination center supported by the private sector. But that means destroying that, one of the few remaining green spaces in Metro Manila. And we know that urban forests are the lungs of the city. And so we need to make sure that when we plan healthcare investments, infrastructure investments, we look through a planetary health lens and scrutinize through these different environmental considerations. And then final example is health scholarships and health grants. I think in the health sector, we're used to receiving any kind of support, especially financial support, while turning a blind eye to their past record, whether they've committed human rights violations or destroyed natural ecosystems. As long as they give us money to support either global health scholarships, as you can see in one university in Europe, and also fossil fuel companies supporting disease eradication programs for decades. Again, ministries of health have actually worked with destroyers of the planet in the pursuit of health improvement. I think we need to start questioning ourselves, these kinds of decisions. So I'm approaching the end of my talk and my response. And I think, we need to start looking at what do we mean by a planetary health-oriented business. And, again, I mentioned John Quelch from Harvard a while ago. He came up with this framework, building a culture of health in business. And as you can see, it's not just about consumer health or community health. Jen mentioned the health of employees is also critical, but also environmental health. What is the environmental or ecological footprint of these industries? I'm pretty sure those who are in the realm of business in the audience, they're familiar with ESG reporting, environmental, social, and governance reporting. Jen mentioned a while ago that there are industry initiatives to somehow, monitor their impacts and hold themselves accountable. But my question is, are these forms of reporting truly measuring the gains or the harms done on both health, human health and planetary health? Or is it greenwashing just by counting the number of trees that you've planted in a previously deforested area? I think, as I've said a while ago, we need to support this movement towards climate smart, net zero healthcare. So future investments in healthcare should always consider the impact not just on people, but also on the environment. And I invite you to take a look at this report that I co-wrote very recently, a global roadmap for healthcare decarbonization. And we want health hospitals, healthcare sector, healthcare systems, whether it's public or private, to be investing in green renewable energy, to be making sure that future hospitals are not built at the expense of environmental considerations. Since I'm talking to the National University of Singapore, and I don't know if the university has already divested from fossil fuels or not, I think one thing that we can actually do for Planetary Health is to remove all our investments, all our money, all our stocks from fossil fuel companies and putting your money where your mouth is. Oxford has already done it. My alma mater, Harvard, is still yet to do it. And so I wonder if Asian universities are also divesting slowly but surely from bad and ungreen investments. And Jen already mentioned a wide gamut of interventions that we can do on the commercial determinants, whether they're taxation or bans or traffic light systems in terms of nutritional labeling. I think we can also use these tools in order to hold corporations to account when it comes to their impact on planetary health. We need to know if products are produced in a green, sustainable manner throughout the life cycle of the product, from extraction all the way to disposal. So these are just some examples of tools. And finally, I think in this day and age of planetary health, we need to shift and expand our vision from sustainable development. Unfortunately, sustainable development as a concept has been captured by the corporate sector. I think there's a lot of greenwashing in the sustainable development discourse. As you can see, they always describe it as the triple bottom line of people, planet, and profit, and instead shift towards a planetary health approach. And I would like to introduce to you this new economic model. Jen also touched on the hard questions, capitalism, neoliberalism, and actually tackle those root causes of the commercial determinants. One of the proposals is what we call now the donut economy model. What is the future economy that protects the planetary boundaries, but also ensures that the social foundations, food, water, health, education, gender equality, etc., are being met? So that is a question, and that is a proposition that I am making. If we want to truly advance the health of people and planet and tackle the commercial determinants head on. Thank you very much. Jason, you're still muted.
I should not be. Yeah, thank you very much. Sorry about that, because I was trying to find my Zoom screen on my desktop. Thanks very much. Okay, so yes, you have expanded it, and basically caused even more confusion in my mind. So now we have got a lot more pieces to put together. Now, of course, there are always other sides to every concern. And so now I will invite Pingy to come online, and he will be speaking to us as a respondent about from one government's perspective of how to balance all the pieces, because we, both from Jen and from Renzo, we know much needs to be done, but the doing is very difficult. And I suppose here that P will be speaking not just from a governmental official's perspective in terms of his experience in health, as well as public health, but also in terms of the economy and how because we need to keep the country sustainable even as we pursue these objectives. So over to you, Pingy.
Yeah, thanks, Jason. I don't have a presentation, but I might have one slide I will show shortly. I suspect I'll be adding more confusion to the discussion, but I thought to take the perspective of having been in a couple of public service agencies, but in a small sort of urban, sort of one city country, and therefore sort of the mistakes we've made and our pilots and the results we are trying to replicate may or may not, I guess, be relevant for larger jurisdictions or larger countries. But I thought then, starting from public service and sort of a service mindset, then there needs to be some basic focus that we can sort of center our efforts around, whether they are regulatory or not. So I thought maybe I would pick this one, assuming this works. It's displaying. Yeah, okay. No, so I think this at least for Singapore, I think does guide how we go about health and healthcare. At the risk of maybe being a bit cheesy, but I think fundamentally it is the public service agency's responsibility to ensure that there's good health, quality of life is as high as feasible, that citizens do have access as and when they need healthcare, and that when they access it, it is affordable and it is sort of being taken care of in the back end when it comes to financing. I don't propose to go into financing mechanisms. I'm more than happy to take subsequent questions if there's any interest, but maybe to stay on point, I think then government's responsibility really is to ensure that there is sufficient regulation. So that's actually, for me, point one, that the regulatory framework has to be in place, it has to be robust, it has to have at its center public health as being of primary importance. And that regulatory mechanism or framework shouldn't just be on paper. You have to have the ability to exercise it, to so whether it's a COVID-like situation or it's a sort of non-COVID, there has to be the ability and sort of the system capability to follow up on what, for example, if you put in say penalties or incentives to be able to follow up and deliver, or at least test those results to see if you're indeed getting those results for the regulation. So that will probably be my first point. My second point is really supply and demand in a given jurisdiction or a given system do matter, i.e. to have an understanding of what sort of constitutes the supply side of the situation and what constitutes the demand side. So maybe as an example, if companies are supplying something, how do we work with companies to influence the supply? But then on the consumer side, how do we then work on consumer education, whether it's financial literacy, healthcare literacy, or what they use to purchase the products. So if a product is healthcare, what is the financing that the consumer is using to access that healthcare? Is there something we can do about those financing mechanisms? Do you have, for example, insurance, co-payment, and so on? Because I don't think there's one single, and my sort of previous presentations have said that there's not one single magic bullet that you could use that would sort of overnight solve everything, and therefore you need supply and demand solutions working in concert. So that's kind of my second point. My third point is then again speaking as a sort of from perspective of a small urban population. If I use a specific example of health promotion, we have been sort of experimenting with it for several years now, both on the supply and demand side. So on the supply side, indeed, as a small market, although we are urbanized, we are still a tiny market, influencing providers on labeling, on health relevant sort of health information or products. Those are things we have continued to push on, sometimes with success, sometimes with areas for improvement. So whether you're trying to influence fast food offerings and so on, or say reduce the amount of sugar use, reduce the amount of salt use, put in, for example, brown rice for local hawker food and so on. Those are things I think we continue to push on the supply side. But then on the demand side to, I think, empower consumers to understand what they might be buying, that there are viable alternatives that, for example, taste the same. Maybe some Asians are very fussy about the taste of their food, but to ensure them that if we substitute ingredients, it can still be sort of the same food as you remember it. We have had some success on using a bit of technology and mobile apps to slightly gamify the process that if you purchase sort of healthier products from, say, supermarkets and so on, you might sort of be able to collect, whether they're points or stamps, and those give you a bit of a, if you collect enough, give you a bit of a kicker, of a bit of freebie at the end of it. And these continue to be pilots. Like I said, we only maybe understand what could work for, say, Singaporeans. But we're beginning to see a bit of interest and success with maybe even elderly sort of members of the population, in that they are motivated enough to consider a healthier choice. Now whether they are motivated because they want to collect the points and they take long walks to collect the points, they did take the long walk. So I think we'll take whatever progress and success we can get. So I think sort of acknowledge the earlier presentation to say we need to tackle all parts of the value chain. I think for us, we are still very much sort of newbies and fledglings to the process, and very keen to then continue to learn what might work. But the size of the market actually sometimes does matter, and we find we need enough sort of market size and market influence to be able to say, for example, influence some of the providers. Maybe I'll stop here and then see how the sort of this discussion continues, and I could come back in again. Yeah, thank you.
Thank you very much, Bingi. Okay, so now we shall go to the more open Q&A. But as a start, before we to tackle the questions, I think I'll just take the questions in a sequence that they will post online, because they kind of like follows the different presentations. And let's clear this up before we have a more free for all and maybe hopefully more wide-ranging discussion. What I find really amazing about this discussion is listening to the various speakers, is that as someone who grew up in the education system where there's usually MCQs, there are 4 possible answers, only one is correct, and there's always one and never more than one, and so on. Very kind of a definitive kind of thing. Whereas now we are heading into a very complex world. Everything has got knock-on effects. To some extent, we already realized that, because many of the problems that we see today were in part created by the solutions for our previous problems that we came up with. Right? So I think a big question here is, how do we solve problems that doesn't lead to future issues, which is kind of like what Renzo is focusing on. But the other part about it is also what Bingi just mentions about it is not about a one-time solution that will fix everything for sure, but with a multi-party. But even then, it is not even about a solution that you can implement over time, because the moment you start implementing, the environment changes, and you have to keep adapting a solution as you go along. So we're living in a very complex environment. So let's go to the questions. And I see Gerald DeSilos would like to know if the commercial determinants of health do you consider it something that is separate from the social determinants, or is it like a subset? And that is obviously posed to Jen.
Well, you hate my answer, because I'm going to tell you both in some ways. I teach the social determinants of health, and if you go on the outsides of those rings, you definitely get the commercial forces as one of those sort of outer systemic factors. So it's certainly considered a subset of that. And even as I sort of showed in one of the slides, you can see if you look through those different factors, whether it's discrimination or water and sanitation or food security, commercial actors are implicated directly or indirectly through a whole range of all those levels. So yes, it's a subset of the social determinants of health. However, it's also, especially in the research world, considered completely distinct from that in its own body of research. And certainly, I deleted a slide because I had too many slides, but there's some interesting models looking at the commercial determinants of health, much in the same way as that, where you have this hierarchy of influences flowing through, whether it's at, deregulation, capitalism, the sort of norms and ideologies that we exist within, and then the various mechanisms through which commercial actors then impact on health outcomes. So both. I'm so sorry.
I think that's great, because I preceded asking the question to Jen by talking about how it's a complex world, and we have this that side remark about MCQs and so on, because we tend to like to think of the world in a very clear way, where I can put this in this box versus that box, but that's not how reality is. And you find that as you read up about CDOH and stuff, there are many models out there, but I think what we have to bear in mind is that the model is not the reality. Models are useful only so far as it helps us to understand and make decisions, but we mustn't mistake the model for being what actually is out there, because they're all just representations to help us. There's another question about, because I think, Jen, in passing, you mentioned very quickly minimum wage. Perhaps you could just expand on that a little bit?
Sure. I mean, essentially, it's just saying that, one of the best One of my colleagues says one of the best things that you can do for someone is give them a good job, in terms of mental health, in terms of stress, in terms of, being able to afford housing, et cetera, et cetera, et cetera. I live in Australia, but I'm from the United States, and we have shocking minimum wage. There's a terrible stat where Walmart, one of our major corporations, most of its employees are essentially on food stamps, so the government food assistance program. And many people will have 2 jobs and still barely be able to survive. And so it's essentially just saying, as a basic due diligence, businesses should be able to pay minimum wage is probably not the right term, a living wage. If I'm going to go further, I'll talk about universal basic income. But this is essentially just saying paying someone a poor wage or having inconsistent employment like Uber or something with the gig economy is terrible for health.
Okay, thanks, Jen. I think in Singapore, we have got a little bit of a controversy over the difference between minimum wage and our version of a progressive wage model and so on. So, but let's not get sidetracked into that kind of controversy unless one of the other two would like to say a few words about it, but not about the, but fine, let's move on to the next question. The next question is, how do we balance government's need to attract MNC investments for economic reasons? So they have to work with them because Singapore is like home to something like 6,000-7,000 international organizations, the headquarters and so on. And they have the power. And Jen, I must thank you as a aside on this, because it never occurred to me that when you force corporations to produce healthier products, you make them more richer and more powerful. That is one clear example of an unintended consequence of a very well-intentioned activity. And I think a lot of our challenges these days arises because of these kind of things. So this one, I think, is a broad question. So maybe I could ask all 3 of you to respond in turn. Whoever goes first.
I mean, this is, if you come up with a good way to do this, let me know, because you've solved the problem in some ways. I mean, the very big picture wishful solution would be to have, essentially some sort of global standard, global governing body that could enforce this. One of the reasons we have this issue is that regulations kind of cease at national borders. We have the UN, but it's not that powerful, sorry. You have transnational corporations, and we've got these amazing slides, their GDPs and their revenues and their employment, their employees sometimes exceed national economies. So they're wildly more powerful than some of these countries. So I've heard rumors that Joe Biden, president of the US, is floating sort of like a corporate base tax. So Singapore, you're kind of considered a tax haven, not nearly to the extent that like Bermuda and some of the Caribbean islands, but like you attract foreign investment. Like that's a key strategy for Singapore. And so if we have a base threshold, then companies wouldn't be quite so tempted to go to countries where perhaps standards are lowered, which is often the case with environmental standards especially. The other, and this is probably slightly more practical, but in some ways harder, some countries, as sort of implied here, they really need the financial investment of these companies. Some countries are relatively poor. Some countries are incredibly wealthy. So why don't we have the wealthy countries start setting the standards first? So then, at the very least, the companies are often headquartered there, and you've got, standard setting there. This is just me off the top of my head. I don't know if my panelists have other ideas.
Okay, Renzo,
it's a hard question.
Go ahead,
right.
Renzo. It
is a hard question, and it is a valid and legitimate question that otherwise, this would have been solved already, years back. Some of my answers are, I think one, strong governments and a good quality government is really essential. Governments that know how to deal with the private sector, but also has put safeguards to ensure that they do not easily succumb to influence, especially when it comes to health policy decision making. And I'm actually going to throw back the question to places like Singapore, which is always lauded as having very strong governments. and how they're actually able to work closely with the private sector, but at the same time, put those kinds of safeguards. I think the other part of the equation is vibrant and strong democracies, right? You need a strong government that can assert, that can set rules, that can define the boundaries, but also you need to have a very vigorous civil society that can monitor, that can hold the powerful to account. And as we can see around the world, countries with low quality levels of democracy are also the ones that are easily influenced by transnational companies in terms of, whether it's health policy or environment policy, energy policy, economic policy. And so, that might sound a little bit impractical, but fundamentally, those are some of the solutions that need to start now. Otherwise, we'll be asking the same question again in 10 years' time.
Thanks, Renzo. Actually, you speak of strong governments, strong civil society. That is if they're going in the direction of protection, but equally, if they were to go in the other direction, they will be just as effective. So it's kind of like a two-edged sword in this case, right? So you said you throw the question back at Singapore. That means you're throwing it at Pingy. So over to you, Pingy.
Again, sort of, I guess, based on what I know, and also based on what we have been working on, maybe I get the tax kind of perspective out of the way first. I think we've always participated formally in the international tax discussions. So we've been part of the process, largely consensus-based. So all countries' perspectives, I guess, would be presented as part of the sort of consensus building process. But I thought for Singapore, we've always participated in international tax discussions. We have actually been peer reviewed and by other countries. So to confirm that our tax practices are not harmful. So that's sort of there for the public record. And I think we continue to participate and we continue to welcome the ongoing periodic reviews and so on, because we do want that assurance that we're running a substance-based economy, that where companies do set up here, they have actual economic substance, they are not shells, and that they do actually generate good jobs for the resident population and generate genuine economic activity. So I thought to just leave that assurance from the tax lens there. And it is a fairly open book in the sense that, we get reviewed and we've passed the reviews. I think then to the broader original question really is, it's about it's about attracting, I think, good jobs again, jobs that enable the population to either apply their skills or to grow and develop their skills so that you sort of stay relevant. Again, it's easier said than done. We might have slight sort of nimbleness as a one city country to be able to attempt some of these synergies as an urban population. So for us, we are careful about the quality and the type of investments that come in. We do want to make sure that they do meet norms and don't run foul of any kind of international standards or practices and so on. So I would say we continue to look ahead. Being a small island, I think environmental sustainability, green issues are of great concern to us. If sea levels go up, then we are a small island. So those are things that we are very concerned with in terms of sort of subsequent growth and development. We want to make sure it is indeed sustainable. Yeah, thanks.
Pingy, if I could ask, the question here is about how do we balance? So at one extreme, obviously, we need to have companies coming to Singapore, investing and growing our economy, keeping it going. On the other hand, there are certain industries we don't want them to come in, and some of them are very obvious, where there's criminal activity and so on. But then the question is the balance. Where do we find the mean? And if we have got, let's say, tax or economic incentives for companies to come to us, and they are dealing with a product which is not illegal, not criminal, right, but which is harmful in terms of health, in terms of the planet. Do we factor that into our decision making as to whether we will give them those incentives, or
so again, I mentioned sort of the one city thing. I actually don't know how larger countries would balance it, or even medium-sized countries. Our economy isn't that huge as to sort of have these, I guess, dilemmas at the sort of planetary scale. I would then say, again, we just have to make sure the economic substance is there. There's actually sort of no public health harm, and so on, as you have characterized. But it's not really this sort of soul-searching kind of dilemmas that that I have had to encounter sort of on a daily basis. But I would have to say we are very, very careful indeed. I suppose the closest I could get to would be we have thorough debates, for example, if you recall, before the integrated resorts came in, and those will be robustly debated, say, in Parliament and so on. So we do want to have that process of very healthy public engagement and discussion by the population before new industries come in. Thanks.
Thank you. Okay, let's go on to the next question then, which is that here it says to increase public health, the most influencing factor is industry. People know which are healthy products and which are not, but healthy products are more expensive than rubbish ones, I quote. So how do we balance, so how does, in this case, I presume is looking from the perspective of the organizations, the producers, right? How do they balance being healthier with being more affordable and having a larger market share? So again, I'll throw it to all three speakers. Anytime you start.
I mean, I guess one way to think about this is to flip it on its head. You can either make a product more affordable by making the product cheaper, or by giving people more money to buy the product. So again, if we've got healthy wages and people are earning, a living wage and have a good income, you don't have to make that terrible decision of, gosh, am I going to, pay for heating in my house, or buy healthy food for my children, or pay like medical bills, which, is sadly a question for lots of people, especially with, COVID-19 unemployment pressures. So I'd say, having good employment might address, the cheap question, and having things very cheap often is not necessarily great, because it either leads to really poor working practices or really negative environmental or health externalities, which I'm sure Renzo could talk about. And the competitive thing, I'm all for competition. Competition from an economic standpoint means lots and lots of small businesses. It doesn't mean one huge monolithic, oligopoly or monopoly. So if we can have antitrust regulation so that we have many companies all competing with each other, that naturally, from sort of a market standpoint, would drive prices down. And then you'd have cheaper stuff just through competition and research and development, as opposed to just a few companies owning most of the stuff that we buy.
Thank you, Jen. I commend how subtly you reoriented my question, because I was asking the wrong one. Because the question isn't whether how to make it affordable, how do you balance this, but rather the larger societal issue, right, of how the actual economy and the ecology actually operates. And it's about the power of the big companies as well. So it's not just, so when we confine ourselves to the product, there are important questions to realize, but it is not the biggest question, and we mustn't forget our context. Thank you very much for that, Jen, and also for your subtlety. Renzo, over to you.
Right, just to add, first, I think the question best illustrates what Jen was mentioning a while ago. These are not behavioral risk factors, they are commercial risk factors, because as you can see, people actually want healthier products, but it's, for instance, the cost and the availability that are determining, their health choices. And so, maybe we should start refraining from using behavioral risk factors from now on in the field of public health. Regarding how to, again, not just about reduce the costs or provide more incentives, but really change the industry structure. I think that's what I'm also hearing, right? We can learn lessons from, let's say, the experience of solar power. You know, more than a decade ago, solar panel was deemed expensive, inaccessible, and then now, more than a decade later, it's even cheaper than fossil fuel generated electricity. And so, if we can do that in, for instance, solar power in the energy sector, in environmentally related sectors, we can definitely do these kinds of things and restructuring of the industry when it comes to food and other commodities that have direct health impacts.
Thank you. Pingy, would you like to add something to this?
Nothing new. I think it's, to me, still part of that supply and demand. So I think for us, where it's worked, for example, if you have a sort of a, say, chronic patient in the healthcare system, sort of receiving periodic treatment, then you could combine both the medical sort of treatment advice with a recommendation for diet adjustment, and then to say, consider these healthier choices. So it's kind of in the health promotion, health education space, but with people already kind of semi-captive in the system, that at least gives. And then from a risk point of view, these are individuals who can directly benefit from some of this moderation. And I suppose then it takes a bit of working with enough alternative providers to have them realize these options. And I know this doesn't address those who are in the sort of population at large, not at all interacting with the healthcare system, but you always have to start somewhere and work with what you have, and then maybe build that into a movement. And maybe those sort of patients, chronic patients, could then influence their family and their community, their neighbors, and so on. Yeah, but it will take a while. I don't think it's an overnight. Yeah.
Thank you, Pingy. Okay, so the next question is again for you, Jen. We tend to work where we are, within the reach of what we can do. So the question here is that for those organizations, the people who have been involved so far in looking at the behavioral aspects of health risk, now they want to do something about it. To tell them that now this is a commercial determinant, it's not a social determinant, so you're not useful here. That won't satisfy them, and if they are concerned, they would like to do something about it. So the next question is, how do the people who are involved with trying to influence behavior, and if they are convinced that actually they need to go upstream, how can they get involved? How can the health promoting organizations move upstream?
I mean, in some ways, it's a fundamental ideological shift. As Renzo sort of noted, public health is very comfortable in its behavioral, individual sort of health promotion mentality. It's easy, it's safe, it's tried and true. It often comes with very catchy slogans and great photo ops as well, which makes it, it has a lot of sex appeal for funding and schools and everything else. And, talking to lawyers and, dealing with politicians and all of that and documents and, I considered briefly becoming a forensic accountant, because then you can dig through, corporate tax things. And there's nothing sexy about being a forensic accountant. Sorry if anyone is on the call.
I doubt it, but okay.
But I think it's trying to become a little bit more comfortable with the boring and the very deeply financial. I would say that all MPH students should be talking to the business schools and probably taking some classes around sort of basic economics, because business literacy is really, really crucial to understanding that. Probably throw in law as well, for that matter. Some of the best information we have in public health has come from when companies had lawsuits taken up against them, most recently Monsanto, and before that Philip Morris, and you have these amazing internal documents demonstrating intent to do harm or intent to camouflage. So if those organizations that are currently engaged in health promotion can sort of shift their focus to look at those, and I'd say the first easy step would be talk to people in law, talk to people in business, talk to people for which it is familiar, and then you can find some common ground and see where you can go from there.
Thanks, Jen. I think if I could summarize what you're saying in a different set of words, is that for these organizations to stop focusing on what they do, but rather to move to what the outcomes they're trying to achieve, and then move to whatever processes they need to achieve those outcomes. I think it's a common tendency for us to be very focused on our abilities, our current focus areas, and what we do. And it's that paradigm shift that needs to happen as well. Renzo.
Oh, well, I would just like to echo what Jen was saying about business literacy, legal literacy among public health professionals. And, you know, I guess, you know, for the Soswi Hook School and all the other schools of public health representing the audience, this CDOH, you know, concept should now be part of the core content of public health education if we want a generation of public health and planetary health professionals who know how to assess contracts, negotiate with the private sector, make decisions in healthcare and public health. So I would just like to echo what Jen mentioned a while ago. Thanks.
Thank you. Actually, the two of you have just given me a justification for why I did my MBA after I finished my public health degree. So, and yes, I found it really useful. Now that with you, Renzo, let me go to the next question. And I think there's someone who obviously knows you and your interest in health impact assessment as well. They're asking about how do the principle or processes of health impact assessment, how do they use that to reach the proponents of the proponents of the action against commercial determinants of health?
Right. Thanks, Jason. So HIA is one underutilized tool in public health. It's a tool that has been existing for decades, but very few countries actually require the conduct of HIA when it comes to, you know, future construction of an energy plant or a factory or, you know, even a new shopping mall, for instance. And so I think we need to look into HIA among its other siblings. There's an environmental impact assessment. There's a social impact assessment. I would say that the way to go is to implement an integrated impact assessment that brings together all of these considerations. As we're all discussing, you know, it's all about achieving that balance. And the way you can actually achieve that balance is if you surface all these issues from the get-go, you know, the health considerations, the environmental considerations. And I think this is also a tool that can really engage not just the corporations to be part of the conversation, but also citizens, because HIA, EIA, and all these impact assessments are best done in a participatory manner. So, you know, the voices of the communities, for instance, that will be directly affected by all these commercial activities should be represented and not merely tokenized. Those are just some of my thoughts.
Thank you. There's an interesting question coming up here. Besides Jen, you were talking about power, and power, a lot of it relates to having resources, being able to effect certain actions. But there's also the power of a knowledge imbalance, because many of the industry players know a lot more about their own industry than any government is able to. And especially where the experts tend to be employed by the best paying employer, which are these in this industry. So the next question is, how many governments obtain the expertise and knowledge which is in the industry? And how do you actually have a conversation when there's asymmetry of a knowledge and there's therefore an asymmetry of power?
I mean, I suppose that I would never say have no engagement between governments and business. There's absolutely a place for conversations. I think the biggest concern is when there's influence over that decision-making process. If we think of industry as a range of different stakeholders who possess information and knowledge that should feed into government decision-making, there's absolutely a space for that. Should it be 100% transparent and well-documented? Yes. I would say in terms of thinking about that balance, one of the ways that could be improved is governments are going to have information and expertise from industry. We should also be getting it from communities. We should also be getting it from local stakeholders, from indigenous communities, from environmental organizations, from other organizations, so that it's not just one perspective. And industry has a very loud voice and a very good connection with this governments. So I think there's an obligation on the part of governments then to reach out to those who don't have as loud a voice or don't have as many good government connections, and having those other perspectives would probably then help balance what industry contributes to government.
Thank you. I'm realizing we have a lot of questions that we probably wouldn't be able to finish in another 13 minutes. So let's do a more rapid fire kind of sequence. So the next question here is for Ping-Yi. The question is whether agencies have a strategy on how to convert extrinsic motivation to intrinsic.
Yeah, I think it's still very much a sort of pilot kind of experiment for us. I think that the theory is easy to understand, but you can't really force it. It has to come together naturally, because it could backfire if you over gamify something that might be perceived as a serious, say, public service, and you sort of don't want to give that wrong impression. I think where we found that gamification has worked tends to be in the softer push aspects or in the education sort of literacy aspects. But if you get down to something that's maybe more time sensitive and the job just needs to get done, then gamification is probably not an easy thing to apply. So for us, we're still looking for opportunities to sort of incentivize some of the behavior we want to see. Yeah, thanks.
Thanks, Ping-Yi. I should skip some questions, my apologies. Many of the questions, if you look down the list, you will see the questions are around, is it because of this or because of that? I think one of the things I've learned today listening is actually because of all of them in concert, because it is maybe a good model is the good work that's been done in Australia in restricting tobacco was a product of multiple factors. So you can't say any one of them did it, which is what Jen was telling us. So if you, some of the questions they're asking, can it be, for example, because of a weak public health authorities? Well, or weak public authorities? Well, yes, it could. But just having a strong one doesn't mean the problem is solved, because there will be other factors involved. So I can see Renzo nodding there. So I'm on the right track here. So I should skip some questions and look for some which are in a sense more controversial or which haven't been mentioned yet. Sondao is asking whether there's such a thing as a sustainability index that can capture CDOH or distance from health or penetration across multiple countries so we can compare across. Is it even possible conceptually? Right. What are your thoughts?
Yeah, well, I'll start. So, I mean, there are so many ways by which industry is measuring themselves, right? I already mentioned ESG. And while the ESG reporting is not mandatory, now I think every major corporation and transnational company in the world thinks that having an ESG report is sexy. Having said that, I also raised the question a while ago about what is happening with these ESG reports, and are they truly measuring the real impact on human and planetary health? Because it looks good if your company, for instance, planted X amount of trees in the Amazon or in the Indonesian rainforest, but if your company is also producing harmful products, whether to people or planet, and produce in an unsustainable way, you know, that sustainability is really just an icing on the cake rather than part of the chiffon of the cake itself. I think we should be holding companies to account. And that's why, you know, the CDOH framework or the CDOPH, Planetary Health Framework, is quite powerful so that we go beyond the cosmetic in terms of ranking and rating and, you know, naming and praising companies or shaming companies if they don't do, you know, well based on our shared values and goals.
I think it might be a real challenge to capture it in one index because, for example, we are in healthcare. No doctor expects the laboratory to give one number to summarize the entire biochemical status of an individual. You want the separate numbers. So it's kind of, it might be intrinsically very challenging to have, other than perhaps, as Renzo points out, as a feedback mechanism of naming and shaming and so on. My colleague Yvette asked on the issue of this divestment. How do we convince governments, especially the non-health ministries, like trade and finance, to divest the anti-health industry? I mean, would it be possible in any country for the government to outright say that we will have no tobacco companies stationed in our country? That is would be a bit of a dramatic statement. So what do you think?
Jen, do you want to start?
I'd say again, you want to start with the countries that have the greatest sort of wealth. And so we do have like sovereign wealth funds, right? So the Norwegian health fund, they have their own sort of parameter on what they will and won't invest in, probably missing a whole lot of companies and criteria according to what I would consider. But that's absolutely a start. And so certainly you could think about, or Temasek, right? Who's sort of co-funding this. They're a government branch of investment. And so I think starting with some of those, there's certainly examples that can follow. And I think with a lot of this, the same with regulations, we've got some, sorry, you can hear my daughter maybe.
She's agreeing with what you said.
I think there's sort of a domino effect. You get enough countries, or you get the countries that other countries tend to follow to do this, and then others will follow. We've seen a lot of examples in the food space in Central South America with some very progressive regulations. And now we're seeing, because it's been tried and tested, other countries are now willing to do it because they see it works. So we need to have a few brave countries demonstrate that this works, that their governments and their economies aren't going to collapse if they have these restrictions, and then others will follow suit. I don't know who those brave countries are.
Yep. Just to add on divestment, and Jen, you mentioned about the big countries in a way role modeling for the rest. I think that is the same logic why the big universities in the world are now being demanded to divest. The Harvards and the Oxfords, and Oxford and Cambridge already made a commitment to divest in the next 10 years. Harvard, as I've mentioned, has not. And that's quite telling, and that's quite important, because the next tier of universities around the world are looking up to these universities. And if the big ones can't do it, then what more the smaller ones? So that's in a way a signal. And it's important that the leaders do walk the talk, right? You're doing climate research on one hand, and you're also contributing to the climate crisis on the other. That is somehow antithetical, right? But in terms of practical solutions and strategies, and sorry, because my clear example now is what's happening now at Harvard. At Harvard, the board of overseers are now being, slowly being occupied by more progressive, members and decision makers. And I guess that is one strategy to make sure that people in the decision-making table are now being, in a way converted to commit to healthy people and healthy planet. So that's one, because at the end of the day, they're the ones who will be making these divestment decisions. I think also as a country, for instance, the climate crisis is going to imperil the health, not just of the current generation, but of future ones. And so it might be a good exercise to start thinking, what are the industries to actually save and even grow? And what are the industries that have to be made obsolete in the 21st century because they are not compatible to either the health of people and the health of the planet? Hard conversations, because we're also part of these systems. We're all benefiting from it. But if we really want to expand, if we really want to address this, we need to expand our view and think more long-term rather than, in short-term terms. Thanks.
I find myself agreeing in principle with Renzo because these are good things to do, but I suspect there are economic, ecological reasons why it might be very hard to do these things. So perhaps, Pingy, can I ask you to talk about some of the realities that we have to deal with if you just were to go and say, we're going to look at divestment? Maybe from a general governmental perspective or public sector perspective.
I think, again, your ability to influence may have to come from sort of the size of your market and your jurisdiction. And then ultimately, you just have to make that judgment call or that trade-off whether or not you want to engage with a certain commercial party. So it is difficult, and I think there's definitely a role for some kind of either industry norm or okay, industry norm is not the right word. I think international norm or kind of best practice governance norm that can apply, and to find allies and partners, maybe in other jurisdictions and other governments, who might also feel that individually you might be too small to influence things.
Well,
yeah.
Perhaps we are too small to influence what they do around the world and overseas, but we can at least influence what they do locally, right? And it's a question of, so the question here in terms of divestment, it's not so much about whether we choose to engage with them or not, but rather do we choose to not engage with them, right? And keep them out of the country, don't allow them to come in to work within the country. So that is a different kind of decision. Some of it might be legacy, so it took a long time for us to allow the casinos to come into play in Singapore because we had long banned it, right? But other things today that we can ban that might be beneficial to us, if not for the rest of the world. So sorry, Renzo, not everything can be done for planetary health, but at least for national. Okay, so there's we have a few minutes left. There's another bunch of questions which I'm trying to combine into one. I think when Jane, when you were speaking, you were talking about how you are less concerned with the effect of a small mom and pop shop compared to a large corporation and so on. But in many industries, there are many small mom and pop shops together, which together might be as large as even as an MNC within that country. And because there are so many more of them, it's harder to reach everyone. Quality and control might be difficult, safety might be difficult, standards might be difficult to maintain and so on. So do you compare between the organizations involved or the size of their individual sectoral economies? So that's one set of issue. And then the other question is, are we choosing what to target based on how reachable they are? As the MNCs are in a sense easily reached because there are only so few of them, or do we prefer to, or is it because it's kind of hard to reach the other group who may be causing other kinds or possibly even greater harm, but because that's very hard to do?
I'll try to be very, very brief. I'm going to always care about the big ones because it all has to do with power. Tiny mom and pop shops do not have political influence, not unless they create an enormous alliance. And if they are part of a big alliance, they probably have huge industry companies as members, and they're going to have a louder voice in that alliance as well and set the agenda of the alliance. So the extent to which, Walmart, Nestle, Monsanto, major corporations have the ear of governments and can shape policies, shape markets, and through their size, the magnitude of their influence is so much larger, then that's always going to be more important. Sure, we could say that they're, if we think of like HACCP or something, or food safety regulations, maybe we're concerned with the small ones not following it as much. My very sort of blunt response around that is that, well, if some tiny company has poor health and safety, they're not going to impact very many people. But if you think of like the massive food recalls across fast food corporations around all of that, it's huge because they are huge. Also, corporations don't tend to have a very good track record around some of those things. Cynically, note Exxon, note some of the sort of environmental travesties, there's food safety travesties around that as well. So it all comes back to power. The bigger they are, the more I care about them and the more we should try to target them.
Thank you very much. Okay, unfortunately, it's now 3:31. I was told by the organizer I can go to 3:32. So let us do a quick wrap up, maybe like 30 seconds each. I'll just say thank you, first of all, for the three speakers. You have given me a lot of food for thought. I think the biggest thing that you have brought across to me is the sheer complexity of the challenges that we have. This is not a fill in the blank with the correct answer kind of problem, that we need to tackle it from multiple angles, and we need to basically work together in a great many different ways. So perhaps I could ask the different speakers to give your last 30-second address in reverse order, perhaps starting with Pingy.
No, I would just sort of repeat my point that the solution has to come from both the supply side and the demand side, and education has to be a big part of that process, because you want to influence longer term consumption patterns, then the consumer must have all the sort of evidence and the facts available for them to make those assessments. I think governments come in to regulate, to ensure health and safety, to create jobs, but there's a limit to which getting the markets to actually change, because we don't run a command economy. Yeah, thanks.
Thanks, Pingy. Renzo?
Yep. Well, for me, I think this should not be the first and last conversation around the commercial determinants of health, especially in Asia, where we see a lot of the commercial determinants, shaping population and planetary health in the region. And so, because, we might think, oh, the solutions are impractical, radical, even visionary, but we will not be able to find the solutions if we don't talk and if we don't have this open, honest, and inclusive conversation. So thanks again, and kudos to the Soswi Hawk School.
Thanks. Jane, last words?
I had something I was going to say. I wanted to say, I'm talking about how businesses are impacting on health in harmful ways. Business is not bad. Corporations are not bad. They are complicated, and every single entity is going to have something that's health promoting and something that is health harming. And the point of the commercial determinants of health, I like to think, is trying to grapple with that complexity and just be a little bit more savvy and nuanced in how we think about this. And it's not black and white, it's just 1,000 shades of gray. So hopefully that's what we've provided here, is making this very murky and gray.
Thank you very much. Now, this is the last webinar in this series. So thank you very much for all of you who have been following us. I guess the one word that I would summarize the mental model that I have now is about the challenge of keeping balance. As Renzo pointed out to me in the chat on the side, the key word is balance. How do we keep things from going out of balance? And as well, keeping all the different pieces at play, balance against each other. So thank you very much, all everybody, for joining us today. Have a good day.
Thank you.
Thank you.
Stay safe,
Bye.
everyone. Bye.
Bye.